The Mental Health Service Protection Act is a foundation to ensure safe and quality care by licensing programming for addiction and mental health service providers. To keep the public safe, other healthcare professionals in Alberta are regulated, from dental hygienists to lab technicians and physicians. They all have a college that works in the best interest of the public to ensure oversight and accountability of their profession. Currently in Alberta, mental health services are not treated the same as primary healthcare service. Anyone in Alberta without training or competencies can practice and call themselves a counseling therapist, addiction counselor, or a child and youth care counselor. This can be incredibly dangerous for those receiving mental health services and looking to obtain competent support. Passing the Mental Health Service Protection Act will not only provide more appropriate service to those in need, but also expand access to a much larger range of affordable services, increase opportunity for insurance coverage, and guarantee safety when utilizing mental health supports. Counselors, therapists, child and youth care counselors, addiction counselors, and other professional certificate programs will be licensed through the Association of Counselling Therapy of Alberta. This will ensure that vulnerable populations seeking support in mental health and addiction services will be protected and cared for by those who are held to a code of ethics and high standard of practice. Alberta is currently facing a mental health crisis, causing vulnerable populations to grow vastly while leaving children, youth, and adults unprotected. Unfortunately, this causes a high need for staffing and hiring those who may not be educated in the field of addictions, mental health, trauma, and at-risk populations.
Ontario's second largest group home, Hats Off Residential Treatment Services, faced a recent investigation following reports of abusive conditions that some youth faced while residing at the for-profit company. Investigations revealed allegations of human trafficking that went ignored, kids being over-medicated, high rates of suicide, underqualified staff, and violent physical restraints. During a mental health crisis, Albertans see the same lack of attention and accountability, showing the concerning gaps in our current systems. To keep the public protected, regulation and education of counseling staff is critical. Without proper regulation, counseling professionals may lack the understanding of appropriate measures needed to support someone facing a mental health crisis. The Association of Counselling Therapy of Alberta has been working closely with the government over the past 3 years to build a regulatory college that is ready to be opened. Those struggling do not have the choice in who is caring for them, and they deserve more. We as students, educators, professionals, and caring citizens must use our voices for those who may need it most. With your support, we believe that it would be helpful for the government to be reminded of the overwhelming public and professional demand for regulation of the counseling professions. For every one letter or call sent to an MLA, this represents the voice of 10 concerned citizens. We're asking the government to renew its commitment to regulation and make it a priority immediately. To act now, join us by sending a letter to your MLA to support regulation of the counseling professions using the QR code below.